Hello everyone. In this video lecture, I'm going to discuss to you the abnormalities in cell growth as well as the somatic death. Okay. Okay, so the abnormalities in cell growth class, it can be observed in tissues and on the organs. They can appear to be small or larger than normal, reflecting a disease or increase in the size or number of their component cells. So we have three different categories of this type of abnormalities. We have the retrogressive. Under retrogressive, we have the developmental and atrophy. So under developmental, we have aplasia, hypoplasia, agnasia, and atresia. And then under progressive, we have hypertrophy and hyperplasia. And then the last one is degenerative. We have dysplasia, metaplasia, anaplasia, and neoplasia. So let us discuss these types of abnormalities one by one. So first is the retrogressive. So for a retrogressive type of abnormality class, the organs or a part of the tissue is smaller than normal. Okay, so it can be due to a developmental defect or an atrophy. So for a developmental defect, the first one is aplasia. So there is incomplete development of the organ. So the organ is only represented by a mass of fatty tissues or it can be a fibrous tissue. So this type of retrogressive development class, this is most commonly seen in paired structures such as our kidneys, the gonads, and the adrenal gland. The next one is the hypoplasia. So this one naman, this is failure of an organ to develop fully. So the organ it failed to reach or achieve its full maturity or its adult size. This is due to incomplete development. And then we have agnasia. So complete non-appearance of an organ. So there is no organ present. So the tissue itself is absent. And then we have atresia. So failure of an organ to form an opening. Okay, so for an atrophy type of retrogressive, so this one, the size of an organ kay nag-shrink siya, smaller than normal size. Okay. So the next one class is we have the progressive. So for a progressive type naman of abnormality, the organs or the tissues, they are larger than normal. This one can be due to the following changes, hypertrophy or hyperplasia. So review from the previous discussion, hypertrophy class, the tissue nag-increase sa size due to increase in the size of the individual cells. While our hyperplasia naman class is nag-increase ang size sa organ or tissue due to increase in the number of cells. Again, hypertrophy, nag-increase siya. It's because the size of the cells itself kay nagdako. While our hyperplasia is nag-increase ang number of cells onto our tissue or organ. Okay, the last type of abnormality is a degenerative type. So this one, there is a change naman. It is due to aberrations of cellular growth patterns. There is a disturbance during the pattern of development. So we have four under degenerative. The first one, we have dysplasia. So it means disordered growth. There is presence of abnormal cells within a tissue. So this type of change class is reversible. It can go back to its normal appearance, normal composition. So there is an alteration. This is due to an alteration in the adult cells that are manifested by variation in the size of the cell, of the tissue or an organ, the shape of an organ, and its orientation. But this one class, um, this one will not lead to tumor formation. The next one is metaplasia, still reversible na type of change. This one naman, it involves the transformation no, in one type of adult cell to another. So just like our example in the previous discussion, the airways of a smoker, so naa siya metaplasia na change, epithelial na type of change on its composition. And then the third one, we have anaplasia. This one is an irreversible. So it cannot go back to its normal shape or size. So this one is, this is usually utilized as a criteria towards malignancy. So this is one of the basis or starting baseline for a diagnosing a malignancy. And then the fourth one, we have neoplasia. So this one class, there is a continuous abnormal proliferation. The proliferation is uncontrolled, and there is an overgrowth of the tissue. So this one naman ang neoplasia, this one can lead to tumor, formation of tumor. Okay, so now let us now discuss the characteristics of our tumor or neoplasm. So our tumor class, this is usually, it resembles the normal cell. Sometimes it can be unidentifiable, and sometime the degree of differentiation is identifiable naman. So that is the time where we submit ourselves for checkup because of the presence of this tumor. So here are the following characteristics no on how we are going to identify that certain growth on your tissue can be termed as a tumor. Okay, number one, ito may resemble and function like a normal cell. Number two, autonomous. It is non-responsive to normal growth factors. And the third one is parasitic. So when we say parasitic, the tumor completely disregard their neighboring cells. So it will get nutrition, no, and it will multiply while the normal cells will undergo cell death or a necrotic type of death. So we have two different parts of tumor. So we have the parenchyma, just like in the picture, no, the one that is darkly stained. So it is an active element of the tumor. And the stroma or the body, this is the framework or the connective tissue framework with the lymphatic and vascular channels. Okay, so since we already identified the different characteristics of the tumor, we can classify tumor class into two different conditions. It can be benign or it can be malignant. Or in other words, benign is non-cancerous, malignant is a cancerous type of tumor. Okay, so we are going to differentiate these two types of tumor according to the following criteria. Number one, can this one cause or result to death? So for a benign type, usually does not cause death except for infants and a brain tumor. And for a malignant type, it can usually lead to the death of the patient. So differentiation, a benign is well differentiated, while a malignant, some lack of differentiation. So later on, I will explain further what is differentiation about. Okay, the next one is rate of growth. So it is progressive and slow and may come to a standstill regress. Okay, continuous ang iyahang pag-grow sa tumor, but it is slow. And it will arrive at a point where the size of the tumor will stay at that size. And then malignant, it can be erratic. So the increase in size, it can be from slow to rapid. And for the metastasis or the spread of the tumor to other sites, benign, there is absence of metastasis. While for the malignant, so usually it can spread to one tissue to another, one organ to another. So it is frequent. Okay, so in medical terms, how can we identify that this term refers to a benign type of tumor and this term is a malignant type of tumor? Okay, so if the tumor or the origin of the tumor class is the epithelial tissue and the connective or the mesenchymal tissue, if benign siya, ang iyahang ang last niya na words are or letters are OMA. Okay, for the malignant naman, if epithelial tissue, there is carcinoma, connective sarcoma. So we have here an example, no, for us to understand these terminologies or nomenclature. Okay, example, there is a tumor on the epithelial lining of the gland. If it is not cancerous, so adenoma. If it is cancerous, it is adenocarcinoma. And then we have on the lymph vessels naman, there is tumor. So for a benign type, it is lymphangioma. And for a malignant type, it is lymphangiosarcoma. Okay, so we have here another example, the teratoma. So this one is a benign type of tumor. So we term this one as a monstrous type of tumor. So it can grow on any parts of the body. So when you're going to gross exam this type of tumor class, so there are presence of fat, there are presence of hairs, and there are presence of teeth and nails. So it looks like a monster if makareceive mo yung ani na type of sample. Okay. So, for a malignant type of tumor, so we are grading our tumors for us to rule out if it is less malignant or if it is a severe type of a cancer. So, the purpose of grading the tumor class is to establish an estimate of the level of malignancy of a tumor. So, we are using the term differentiation. Okay, when we say well-differentiated class, it means there are presence of normal cells. Okay, the tumor cells resembled normal cells. While if undifferentiated, so the tumor cells do not resemble normal cells. Okay, so if increase or mas more ang number of well-differentiated cells, it means that the patient have a good prognosis. So when we say good prognosis, the patient is most likely to recover compared with our undifferentiated na mga cells. Okay, ma'am, what is the difference between staging and grading of the tumors? Ang staging manggod class kanang stage 1, stage 2, that is for the size of the tumor, extent of the spread of the cancer cells to the lymph nodes, and also the presence of metastasis. Those are the criteria under the staging. While for the grading, we are looking for the resemblance or the appearance of the tumor cells. Okay, so to classify this grading, we are using Borders classification of tumor. So we have grades 1, 2, 3, and 4 with the following percentage of differentiated and undifferentiated cells. But of course, each of this na mga mga guide nato naman yun siya mga limitations. So for this type of classification that we are using for grading our tumors, the following are the limitations. Number 1, it is subjective. So it will depend on the readings of the pathologist. And yes, it can vary from one section to another depending on asa ba na part ang na-check ni pathologist. So it can be on the other areas, mas increase the ang number of undifferentiated cells. Okay, number 2, the higher grades of tumors, have more tendency to metastasize. So, generally, they have more, yes, tendency, no, to metastasize. So, the grading will not be accurate. And then the last one, most sarcomas cannot be graded. Okay, so our sarcoma ay connective tissue, no, na type of tumor. So those are the limitations of this reading. Okay, so that's the discussion on the abnormalities on cell growth. Now let us continue our discussion on the somatic death. Okay, so when we say somatic death class, so namatay na ang tao. Okay, what are the changes that our body will undergo, no, during somatic death? Okay, so we have two levels. We have the primary changes and we have the secondary changes. Okay, so under our primary changes, we have three, and under our secondary changes naman, we have seven. So let us discuss what are the changes na mag-undergo sa body during death. Okay, first one is the primary changes. Okay, so this one, primary changes, it will usually occur 4 to 6 minutes, then death follows. So this one will be experienced by the body during complete cessation or loss of metabolic and functional activities of the body. Okay, we have first the circulatory failure. So this one, this is implying immediate death, since all other functions in our body class, they are mainly dependent, no, upon the cardiovascular activity. So if you're going to base on a medical legal na mga steps during confirmation of death, this is the number one criteria that they are looking. So death can be classified as death when the cardiac function stops. So they are going to look at the pulse rate and the heartbeat. So if both of these are absent, so it means that the patient um, already started to have this primary changes. So this one can be confirmed by a process called electrocardiogram or ECG. So upon checking, so flatline. So pag flatline na, so it means the heart already stopped functioning. So circulatory failure. Okay, the next one is respiratory failure. For this one, this can lead to death due to absence of the oxygen and increased level or accumulation of the carbon dioxide. So with the absence of this oxidative process of the respiratory system, so that one can lead to death. Okay, and then the third one, under primary changes. So there is the central nervous system failure. So there is already loss of coordination, no, of reflexes in various parts of the body. The body is already unable to move, and this one can be confirmed by electroencephalogram or EEG. So there is no activity already sa brain. Okay, so now let's proceed with the secondary changes. These secondary changes class can usually be presented, or we can observe this one using our naked eye. Okay, so we have seven, and this one, these secondary changes, usually it will follow after death, and this one can be observed during post-mortem examination. The first one is we have algor mortis. So algor mortis class, this is the first demonstrable change observed in a dead body. So for this type of change, there is cooling of the body. So the body temp will decrease. So ang rate niya class is 7 degrees Fahrenheit per hour. Okay, so this is important. The temperature of the body, this is important in establishing the time of death. Okay, so they are checking the temperature of the body, no, during mga medical, legal, and postmortem examinations by checking the temperature of the body to know the time of death. The next one is rigor mortis. So rigor mortis, this one refers to rigidity or stiffening of the muscles. So uh, um, this type of change class is first seen in the muscles of the head and on the neck. And then after that, it will spread towards the lower extremities and subsequently disappearing in the same sequence. Again, from the head to the neck and down to the lower extremities. So this one class, this is um, due to lack of ATP. And let's go back with the function of our ATP. Our ATP class, this is responsible no for driving calcium ions back to our sarcoplasmic reticulum of the muscles. So it's because there is no delivery na of calcium ions, the body or the muscle will tend to harden or be kanang stiff. Okay, the purpose of having this calcium ions class is to relax the muscle. So if there is no ATP, there is no relaxation of the muscles. So the stiffening or the hardening of the muscle, this will usually start 2 to 3 hours upon after death. So the body will completely be hardened or rigid 6 to 12 hours after death. So this one is persistent for 3 to 4 days. And after 3 to 4 days class, relaxation occurs due to breakdown of contracted muscles. So by this one as well, they can identify no, if how many days na namatay ang dead body. Okay. The next one, we have the liver mortis. So this one, there is a discoloration. So the color is purplish, and this is due to the stoppage of blood circulation. So this discoloration class, if you're going to touch that specific area, if you're going to put a pressure, it will reappear again when the pressure is released. So just like in the picture that we have there. So ma'am, what if the cause of death of the patient is due to beating, or the patient daghan siyang pasa? How are we going to differentiate it with livor mortis? Okay, so the term for that bruises, for maybe that can be the cause of the death of the patient, is ecchymosis. So these are the bruises before death. So it can be because of, sorry, this can be because of, okay, so let us now compare this two types of discoloration that the body might experience after post-mortem or somatic death. Okay, so for the cause, livor mortis, it's because of the stoppage of blood. So post-mortem stasis of blood. While for the ecchymosis naman, it can be due to trauma, so mga physical abuse and other forms of abuse. And after application of pressure, or we term that one as blanching, blanching test. If it's a discoloration due to livor mortis, the discoloration will disappear, just like in the picture that we have. But for the ecchymosis, so there is no disappearance of the color. Okay, after incision, if the coroner or the pathologist will going to create an incision on that site with discoloration, livor mortis has this oozing. So when you say oozing, there will be blood. Blood will come out on that specific area. While for the ecchymosis or bruise, so there is no oozing. Sorry. Okay. We are already on the fourth one. the post-mortem clotting. So this one occurs immediately after death. And we can only observe this one plus if the body will undergo autopsy. So, so we have here post-mortem clot. This is due to death, and then ante-mortem clot. This is due to, again, ecchymosis. Okay, for the appearance, upper layer is clear, just like what we have in the picture. It looks like a chicken fat. And the RBC settles at the lowest part of the blood vessel. So, curant resembles curant jelly. While antemortem clot has tangled irregular fibrin, so it's not that clear, just like our postmortem clot. As to the shape, so it assumes blood vessel shape for postmortem. Antemortem seldomly assumes blood vessel shape. And for the consistency, it is rubbery, while for the antemortem, it is non-rubbery. Okay, for the last three secondary changes that the body occurs after somatic death, we have, okay, so we have desiccation, putrefaction, and autolysis. So we have desiccation first. So this is most evident class in the cornea and on the anterior chamber of the eye. So the reason for this class is due to absorption of the aqueous humor. So there is drying and wrinkling of the fluid in the eye. Okay, for the next one, we have a putrefaction. So there is greenish blue discoloration with odor. Okay, so the dead body will have this foul smell. They will have this release of gas due to the invasion of the tissue by bacteria called Clostridium welchi. So that is responsible for the odor of this dead body. So um, there is a combination of hydrogen sulfide plus the hemoglobin, and it will release sulfahemoglobin that will that results to the greenish blue discoloration of the body. So and then the last one, we have autolysis, so self-destruction. The self digestion of the cells by their own enzymes. So this is the first external signs is the whitish appearance of the cornea. So with all of the following changes that we have mentioned, so I hope that you already know now what are those primary and secondary changes that the body undergoes after somatic death. So if you have any questions, feel free to ask or clarify with your lecture instructors. So for the reference, um, you can read the following books, Robbins, for the general pathology, and for the postmortem changes naman is by Sheds. Thank you and have a blessed day.